Do you have EDS? And this goes for any form of EDS. I don't typically like grouping all of the forms together, but this goes for all of them. Have you been counseled by your doctor on what antibiotic class to avoid? Fluoroquinolone antibiotics are a class of antibiotics that are not recommended for use in people with both Ehlers-Danlos syndrome and people with Marfan syndrome, which are both genetic connective tissue disorders. And this can also go for other connective tissue disorders as well. Fluoroquinolone antibiotics increase the risk of aortic dissection across the board in patients with these disorders. And it is generally recommended that we are not prescribed them unless there is no other option. Now, if you're on a course of fluoroquinolones now, do not stop it. Talk to your doctor and have a long, informed discussion about the risks of using fluoroquinolones and the possibility of not using them in the future. There are other risks that people with EDS do have in association with fluoroquinolone antibiotics, including Achilles tears, which I have unfortunately experienced. And in my experience counseling with my doctors about it, it is not commonly known by every sector of healthcare that these are counterindicated in certain people with connective tissue disorders. Now, this medication is already black box warned in the US and has equivalent warnings in other countries for its possible damage to connective tissue. But informed consent in treatment is an ongoing and constantly evolving experience for chronically ill people. Fluoroquinolones are generally broad-spectrum antibiotics, and the FDA recommends that other antibiotics are used first for a majority of people unless what you are fighting becomes resistant to other lines of treatment. Be careful, stay healthy, talk to your doctor, and be safe.